everybody, Dr. Samantha Luther here, chiropractor in Lincoln, Nebraska. And today we're going to be talking about tongue ties and lip ties during this webinar. And with being a chiropractor, we like to talk a lot about the healing process during this and also treating the tension within your little child's body that's going on with one of these situations. And so whether you are a parent that, has a kiddo that has this right now, as a soon-to-be mama, just kind of, educating yourself, which is awesome, and getting all the information out there that you can. So if this is something that comes about, you just have the tools and the knowledge to do, and to feel like you're empowered and educated with that. So the first thing, we see lots of kiddos in this office and lots of mamas, lots of families. And so we're able to kind of experience firsthand and almost go through this journey with these parents and this kiddo that might be experiencing a tongue tie, lip tie. And that's just kind of the beauty of it. We're there kind of, there at the beginning for some of them. Some people actually come to us as a referral base from another professional that we're going to be talking about. These three professionals that are going to be huge into, helping you guys through this process. And that's the thing, develop a good team, develop a good group and a good group of professionals that you thoroughly trust and that have your back and that are just so empowering and helping you get through this process, because it'll just make it all that much better. But with it coming from a chiropractic standpoint, we are the ones, and like what I want to emphasize here is like staying within our lane. There's only so much that I can do as a chiropractor through this, and then there's these other awesome professionals that we get to help, that we get to be co-managing this with you and your child. And so staying in our lane as a chiropractor, we're the ones that are going to be dealing with like the tone of your child's nervous system and how the nervous system affects that tongue tie, lip tie, and then how the tongue tie, lip tie actually affects the nervous system. So it's almost like this tug of war match that's going on within the child's body. And then we're just going to be talking about some other signs and symptoms that might be going along with what's going on with your little kiddo. And so with that being said, like staying within our lane, as chiropractors, we cannot diagnose tongue tie, lip tie. And that's perfectly fine. I don't want to. I want to do my part. But once again, we don't diagnose it. We work with the tension within the body and that dural tension within the nervous system. We'll be getting to that. You're probably wondering, like, dural tension, like, what's that? What's all going on? But with that, and like how chiropractic influences the nervous system, and once again, just staying within our lane, because there's going to be some awesome other professionals that we're, like I say, going to talk about that are going to do a lot of the other stuff for us. But what I want you to get from this webinar is there's just so much information out there, and maybe not having like, completely understanding what's going on. Taking a look through a different set of lenses is another thing to know, because whenever you go into, and my goal for you with this webinar is just to feel like you're so educated and empowered, because you're going to be going to doctor's visits and going to pediatrician visits, and like they might not fully explain this to you, and you leave there almost feeling as frustrated as whenever you came in, or if not more frustrated. And it's like, I just want you to have this education, because an educated person, you then can go into these appointments and feel empowered and go, well, and then you can almost question things if you feel like it needs to be questioned, or otherwise what's being said to you, you're able then to process it and understand it a little bit more, versus walking in there and walking out going, I have no idea what's going on now. So that's what I want you to get from this webinar is just, is just feeling that immense level of educated and empowered. So with that being said, let's go ahead and talk about there's going to be a triangle of professionals that you're going to want to have on your team during this time. And so the first one that usually is the one to come about a child with a tongue tie or lip tie, it's actually not chiropractors at all. It's going to be these awesome nursing and lactation professionals. And so they're the ones that you're going to be, and like, if you don't have one right now and you just had a baby, kiddo, no tongue tie, no lip tie, no nothing, like get a lactation consultant on your side immediately, because these women, sorry, most of them are women, these women are just a wealth of knowledge. They are going to be able to help you give all these tips, tricks, and like all these small little changes can make a big change with how that process is going for the nursing part of your postpartum journey. And so getting them on your team, and it can be so difficult with the nursing and getting it down right. And so then like the baby's getting enough and they're growing and doing all the things that they need to do. But like I said, consult with them right off the bat. That'll save you a whole host of headaches later on. And like I say, they're just a wealth of knowledge in that nursing aspect. But with that being said, they're going to be one of the first ones that say, well, let's go ahead and let's look at the kiddo. What do they have going on? And they might be able to see like, okay, we got a tongue tie or a lip tie, or we have both here. Let's go ahead and now we're going to move on to our second professional that we're co-managing this with. And that's going to be one of those revisionary doctors, or like the pediatric dentist that's going to be working with these revisions of the tongue tie and lip tie. Now, these doctors specialize in this, so be sure to kind of like look for that. If you have any questions, ask. I can help you with both of these types of referrals, of the lactation consultant and the revisionary doctor. But they're the ones that are going to be able to go in there and actually diagnose it and kind of get a path going for you guys. So we have the lactation consultant that's going to kind of help us with that aspect. We have the revisionary doctor. And then we always need a person on that third little part that's going to work with body work. And now as a chiropractor, that's what we do all day, every day, is work with the body and how it is functioning. And so with body work, we want to definitely focus on like their nervous system and like the tone of their nervous system. Because if it is wound tight and it is excited and it is stressed, that tension within their nervous system is going to cause more tension. And what's going on here, I have a little lovely picture for you guys. But like that increased tension and an increased stress and increased tone within their nervous system is going to cause this tongue tie, lip tie to, even if you were to go get the revision and not have the body work done, it's not going to have the full, awesome, amazing benefit that you could have. It's still going to do some things, but it's almost like not getting the full effect that you're wanting. And that's why it's so important to get a pediatric chiropractor that emphasizes, and knows how the body works with these little infants and these little kiddos. And then that way, like, we are able to relieve the stress within their system, relieve that dural tension that we're going to talk about. So whenever they do get the tongue tie or lip tie revision, like, the rest of their body's just relaxed and it's not going to kind of snap back and have more tension within it. Like I say, so going into what's kind of happening, to recap: lactation consultant, revisionary doctor, bodywork doctor. You got it. And I'm definitely one of those that could be your bodywork doctor. As a chiropractor, we definitely focus and like have extra training. I do anyway with the ICPA, which is a Pediatric Physicians Association, and we have been thoroughly trained on working with these kiddos and these little infants and all that, like, and understanding like the cranial work and the sacral work and how their little nervous system functions and operates. So we're able to so we are able to apply that gentle, very specific pressure that we do with these infants, and we're able to work with like the cranial bones and stuff like that, and just applying the ever slightest gentle pressure and helping with these kiddos. And so that's part of the body work there. But let's go ahead and let's hop into what is going on. Why is this happening? And so I have awesome drawings, by the way. Look at that. So within our bodies, and as we are developing, we have the brain and the spinal cord, okay? And so like that's what that little circle is, and the black line going down. And then we have this outer protective layer, okay? And that is called the dura. So you've heard me say dural tension quite a few times yet, even already. And so dural tension, so what that dura is it's almost like an Under Armour layer, like that clothing that's very, very tight to the skin, but yet allows for breathing and movement to happen underneath that layer. But it's very tight and it's very strong and it's very encapsulating. And so we have that dura, and in between there, you can kind of see my little squiggly line there, we have something called cerebrospinal fluid, or CSF. Cerebrospinal fluid is a vital part of our body. It actually bathes and coats our nervous system and allows it to bring the proper, nutrients and all of that it needs in order for that nervous system to continue to function and develop as it should. And so like there's just a very small layer of that within that protects the spinal cord and this and the brain. So like I say, we have this dura on the outside. But what's really interesting is we have major attachments all the way down at the sacral level, which is the tailbone level, and all the way up top, very close to the base of the skull. And so there's these two segments right there that has a great amount of attachment with that dura to our spinal cord and column. And so with that, with our little kiddos that have this tongue tie, lip tie, then we're also going to have this little itty bitty tongue with these anchors going. Those are pretty exaggerated anchors, with these anchors going on. And so what happens is like at those little points there, where those attachments happen, if there's so much tension and so much tightness and almost torsion within those areas, that's going to cause that dura to get irritated and that dura mater to become tensed and super toned. And so whenever we start to think about releasing that, and with a tongue tie, lip tie, we have these 3 points, the sacral, the cranial, and the tongue, that all kind of go together and go hand in hand. So if you were to go in there and just remove the tongue and lip tie anchor there, you're still gonna have that dural tension there at the base of the skull and down there at the sacrum. And so if you think about a rubber band, and you have the one down up, yeah, we have the one, sorry. You have the one up there at the cranial aspect, and you have the one down here at the sacral aspect, and then we have like the tongue one up there. If you release just one end, you're still gonna have this a great amount of tension and stress in the bottom one. So you need to release that bottom one as well so that rubber band can actually relax. Same thing with the dura that's going on with these young little kiddos. And so as a pediatric chiropractor, that's where we have the knowledge to go in there and release that tension and allow that rubber band to kind of relax and to give way. Another way that I like to put it, think about this too, is if you like to have like a wrung out towel, you know, that you've wrung out, you've let it lay, you know, in the back of the pickup, and it's laid there and it's dried up. And so like whenever we go to release that towel, there's still gonna be all those lines that are like, you know, creases within that towel. That's what we're kind of working on. So like we wanna release both ends and then release the tension in between. I hope those are kind of some of those good examples of understanding like that dural tension that's going on and causing all of that neurology to be kind of hyperstimulated, hypertoned, and not allowing that to relax. Some of the things that parents and like some of the signs and symptoms that parents have brought up with their kiddo that might be suffering with this dural tension and tongue tie, lip tie, is they're like just a super, super tensed up child. They're very just, you know, ooh, you can just see a tense child versus it being one of those floppy, loosey babies that we like to see that are super, super snuggly. So that's kind of what's going on within that dural tension and how that affects these tongue tie, lip ties. And now you're probably wondering as well, like what are some other things that kiddos start to present with? And this is almost like an offshoot of tongue tie, lip ties. But we also see, like I say, we see lots of kids in this office. We also see with dural tension, lots of colic and lots of reflux. And so once again, thinking about that wrung out towel. So we haven't released that tension, or maybe we have just a little bit. So that colic's gonna start to show anywhere from 2 to 3 weeks. That reflux is gonna start to show anywhere from 6 to 8 weeks. And it's like it's getting rid of that tension within that nervous system of these kiddos, that then it's able to feel like it can relax and it can do the things that it needs to do. Because with colic and reflux, think about it as an adult. This is what it's equivalent to as a child. If we're, as an adult, if you're to put a corset on us, tighten that puppy up, and have to chug a gallon of water, how do you think that's gonna go? Not very good. Don't try it, but just think about it. That's what's happening also with these kiddos that are experiencing like the colic and the reflux, is like they have so much tension wound up within their nervous system and within their body, trying to swallow and get that down into the parts of the digestive tract that it needs to go. It doesn't want to, and it's just tightly compressed, and it's gonna cause, what's gonna happen? Reflux. It's gonna come barreling back out. So those are just some of the other things to kind of think of as well if you have little kiddos at home that are experiencing the colic and reflux. I have a whole other webinar on that if you want to check that out. But that's just what's going on there as well. And so you might be wondering, like, how on earth, like, how do you find if my kiddo has like this tension within their nervous system? I'm not quite getting it yet. So as a chiropractor within my office, we have amazing neurological scanning. Totally safe, totally non-invasive, all of that, safe from anywhere from like a little infant all the way up to our elderly. And with those scans, we're able to find this, excuse me, we're able to find the tension within that nervous system. And so we have our brain that's way up here, and we have the spinal cord that goes down within our spine. And so you're probably thinking, well, as a chiropractor, don't you just deal with the spine? Yes, we do, but guess where your nervous system is housed? It is housed within the spinal column. And so, excuse me, anywhere up here in that cervical area, like we talked about, like that cranial sacral area, we're gonna have so many conditions that go in there, and everything from, with these little kiddos, colic and excessive crying, ear and sinus infections, sore throat, strep throat. These are gonna kind of get more into your kiddos at this point. But what else do we have? TMJ issues, speech issues, ADHD even within our kids. Now granted, I know we're talking about babies and tongue ties and lip ties, but these are a bunch of things that go on within the upper cervical tension and the cranial tension that allows not these kiddos' nervous systems to develop fully as we would like them to do. And then down into the sacral area, we'll also see kiddos present with like odd, like digestive issues. We have bowel issues, so constipation, odd poops, bedwetting and all of that stuff. And that bedwetting goes into kiddos, more so the older kiddos. But you can see then we're finding within these scans, and we're able to then to see how much of a stress response is this kiddo in versus how much is their body able to rest, digest, heal, relax, grow, and develop. And so we're able to find within these scans what kind of system this kiddo is locked in, and find exactly where within their spine and within their nervous system where this incredible amount of stress and tension is happening. That's the beauty of having the awesome scanning system that we do have here. So just to kind of quickly offshoot one more time, I'm good at offshooting today, but with the dural tension, some things that you'll immediately pick up on, we're going to have some nursing issues. This can be one of those things, it's a large byproduct of this tongue tie, lip tie. But whenever we start to have nursing issues, guess what's going to start happening? We're going to get stressed with that. We're going to get anxiety with that, especially if you've had a kiddo before that the nursing didn't go all that well, and they were screaming, they were crying, they had colic, they had reflux. Well, before that, you hadn't heard of this webinar and understanding like how that actually works and how that dural tension really impacts your child. And so we'll start to see, like I say, with those nursing issues, and you're going to get panicky, you're going to get, you're going to freak out, and you're going to then have self-blame because the baby isn't nursing as good as it can. And as women, we are the most guilt-ridden species there is out there, and especially as new moms, you want the absolute best. And so whenever something goes awry and it's not happening for your new baby, you're going to be so upset, so blaming yourself. I don't want you to do that. Reach out and get the help that you need. And that is where we are here for you. Here at this office, find that lactation consultant, because even like I say, the smallest changes with nursing is going to help you with that. But then also going back to the body work and allowing that baby's nervous system to be functioning as it should, that tongue then is able then to do everything that it needs to do, and the cranial bones are going to be, shifting into the place that they need to be. So then it all becomes like this nice and fluid motion, and nice and fluid, feeling going through even within your baby. They're going to notice it and pick up on it right away. When I start working with little kiddos and these little babies, they immediately, they just relax immediately. They start to feel like there's something called innate intelligence within us. And with innate intelligence, our body knows. We were made to be self-healing, self-regulating. And so whenever you give that influence through body work, their body innately knows, like, this is good for me, this is healing me, this is bringing me into the healing process and taking me out of that stress mode. And so that's the really cool thing with that. And so then kind of get a little bit nerdy here on you with the development, embryonic development. So whenever you think like our brain and our spinal cord, and like even within this lovely, awesome drawing, brain, spinal cord, it is the center. It is the most midline. And so that's how our bodies develop embryonically. It's like everything develops from midline and works its way out. And guess what's very, very midline? It's going to be that tongue. And I've heard many lactation consultants talk about the tongue being like the rudders, like the, the good stabilizing force within it. And it's like if there's any tension within that nervous system or stress within that nervous system, even as the baby's developing, and you might be wondering, well, how in the heck can a baby be experiencing stress? That comes from mom. If mama's, you know, environment around her is very stressful, not taking care of herself maybe nutritionally, or like, you know, there's a lot of changes going on within their lives. Maybe they've moved, or husband's gotten a new job, or like, you know, husband lost a job. You have 3 other kiddos that need to be taken care of. All of these stressors kind of start to impact the mother, and that gets transferred immediately down into the womb and down into this baby that she is carrying. And so alleviating a lot of the stress and decreasing stress and tension during your pregnancy is also huge. And that's where, as a prenatal chiropractor, I work with a ton of pregnant mamas. That's what we focus on. Like, we want that body functioning, developing, growing the absolute best that it can, and like relieving the stress out of it. So we're out of that stress mode and we're into that growing, developing, rest, relaxation mode. Same thing with mom as it is with the babe. And so, like I say, prenatal chiropractic care is a huge thing that we do a ton of here. We influence a lot here. And that's just where a lot of people know, like, this is where I can come, and like, I know my body's going to be in such better shape whenever it comes time, even for labor and delivery and postpartum. So it's really, really cool to see, but just decreasing that stress. And it's like with the nursing, going back to that, don't let that become a stress. Get the help that you need, and like, let's get you moving forward. And so then, but don't be aware, you know, or be aware, but don't be concerned, is with like this tongue tie, lip ties, this nursing aspect is going to be hugely impacted. And so, like I say, get that lactation consultant, get that body work, get talking to that revisionary doctor, and let's collaborate on this. So you have a collaborative effort and you're just not going, you know, in 3 different directions, not knowing what to do. And like I say, the scans we've talked about, that's how we find it within our office. Being a pediatric chiropractor, we have excessive training within working with these kiddos, and, you know, having the cranial work, understanding, and the sacral work, and relieving the tension within this body. And that's just where we as pediatric chiropractors is, we are so much more in tune, like, with these little kiddos. And, you know, we have the extensive work and the extra work that we know how to apply this specific gentle adjustment. We never put more tension into your child than if you were to check a tomato if it was ripe. That is all the amount of tension that we do. Or if you were to take a stick of butter, and you're probably all wondering, like, how are you doing this? You take a stick of butter out of your refrigerator, and you apply just enough pressure with your fingertip to allow that butter to start melting underneath your fingertip. That is the amount of pressure that we use with these kiddos. That's all they need. They don't need any more. They aren't adults like the rest of us and have all these other issues going on. They're just these itty bitty little infants that only need just this little bit of influence into their nervous system to make big, big changes. And actually, as a pediatric chiropractor, the less we do, the better. That's how little that they need, but the impact is incredible. So that's what I want to do, and educate you guys and bring this to you, because whenever you're looking for someone to get on your team, like, it can be terrifying. It can be hard. It can be scary, because you are literally handing over the most precious gift in your life, this new baby, to somebody, and you need to trust them. You need to know that you can trust them. You need to know that, like, you feel like you've had this connection with them. And that's what I want to do with all of you today, is just reach out to you, make a connection. If it's not me, I can help you find another great pediatric chiropractor, but like, just getting that right person on your team. And if you're educated, you're empowered. And if you feel like you can trust someone, that's another stress that goes away. And so with how you gain someone's trust is you educate, you empower, you bring them the information that they need. And then that way they're able to be like, yes, like, this is what my kiddo needs. This is what I need. So if there's anything I can help you with, please don't be afraid to reach out to me. My name's Dr. Samantha Luther at SJL Wellness here in Lincoln, Nebraska. And my number's 402-432-7702, or my email is sjlwellness@gmail.com. Have an awesome day, and I look forward to speaking with some of you.